All right, welcome back and thank you so much for staying with us. And I want us to now shift gears to talk politics kidogo and get into matters health, because today is Thursday and kama kawaida every Thursday we talk matters to do with health. This morning we want to shine the spotlight on dental health in pregnancy and early childhood. Now it's interesting because did you know that there is a direct link between your oral health and your children? Now, whether that is the truth or if it's a myth, we have Daktari PJ in studio with us to help us unpack if whatever I've told you is true or not, but I'm sure it is true. I read it somewhere, right, Daktari? You know, I told Daktari that I'm not going to pronounce your second name because I don't want to butcher it, just out of respect for it. Utaniambia niseme, ebu tell me how you're saying it.
You just relax and say Muriuki.
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 It's like karaoke, but now Muriuki.
Muriuki.
Yes.
All right. So Daktari PJ here is a chief dentist, Nairobi County, right?
Yes. So
you cater to the whole of Nairobi?
Yes, and thank you so much, Anne, for having me, and a very good morning to our viewers today. Like you said, my name is Dr. PJ Muriuki, and you got it right this time around. I am a dental surgeon by training, and I also serve in Nairobi County as the chief dentist, meaning that I am in charge of all the oral health services in the whole of Nairobi County. So that is provision of promotive, preventive, and curative dental services. So that means I work with a team of colleagues, dentists, community oral health officers, and dental technologists to ensure that these services are given to mwananchi. Yes.
So how's our health-seeking behavior as Nairobians as far as dental care is concerned?
It is a concern. It is a concern because, you know, typical Kenyans, you know, we only run to the hospital when things are bad. And, you know, only when people are in pain, that's when they remember that they need to go to the dentist. Ideally, you should visit your dentist twice a year, whether you have a problem or not, because most of the dental issues are preventable. And it's not until it's very late that's when you get to know that you have a problem. But now when you visit your dentist in good time, they are able to diagnose and identify these problems early so that you can be able to get help. But unfortunately, our oral health seeking behavior is poor as a country, and that is why you find most people lose their teeth because they only go when it is too late. Yes.
So why is that you know, oral health seeking behavior poor? Is it because you know, it's too expensive? There's an issue with accessibility, really, to access, you know, these dental health centers that really just care for affordability as well, and also cater to specific needs when we're talking about, you know, dental health. What's the problem?
No, it is, I'd say it's multifactorial, meaning there are many factors that lead to this poor oral health seeking behavior. The first one is lack of knowledge, and that is why I am happy to be here, because we are here to empower the patient and to make them knowledgeable so that they can be able to know what to do when they have oral health issues. The other problem is, like you said, we are very few dentists, all right? I'd shock you that in the whole country, we are less than 1,500 dentists. This includes those who are in management, those who are in politics, anyone who's ever been trained as a dentist. We are less than 1,500.
Including those in private?
Yeah, and we are serving a population of 50 million people. So that goes to show you that, you know, accessing a dentist is, you know, a tough order, because even most of these are located in towns, in Nairobi, and urban centers. 70% of them are located there. So there is that issue of that we are few, but most concerning is if you look at the public sector, because it's the work of the government to provide health services to mwananchi. You'd find that in some counties that I'll not mention.
Why?
No, I'll talk about Nairobi County.
All right.
Yeah, so you'd find that in some counties, a whole county, you'd find they have only 2 dentists. Can imagine a whole county, only 2 dentists serving the population.
Yeah.
That shows there's a skewed distribution of these professionals, and therefore, even if people wanted to seek these services, then they are not able to find them. I remember when I came into this office, we were very few. That was in Nairobi, we were only 16 in the whole county. In fact, the last dentist to be hired was before devolution. Yeah.
Oh, wow.
Yeah, so, but I really want to thank our governor, because when he came in, he's the first governor to ever hire dentists. He hired about 50 oral health staff, which really went to, I mean, it really helped us to bolster the numbers of these professionals who are available to serve Mwananchi. In our sub-counties, we only had 4 sub-counties out of the 17 that had dental, any facility that was offering dental services. Right now, in every sub-county, we at least have a dentist, and we have these services being provided for. And this is really important because, like you say, dental services are not cheap. And, you know, most of our people are exposed to quacks because of that gap that exists in terms of availability of these professionals. And therefore, I always say that we have to make the public healthcare work, even to make sure that we prevent our patients from being exposed to these unscrupulous individuals who are masquerading as dentists in the estate. So I'd want to say, at least in Nairobi, the situation is better. We are not yet there. It's a work in progress, but at least there is a lot of work that is going behind the scenes. And people, I can confidently can go to our facilities. We have Mama Lucy Kibaki Hospital, Mbagathi Hospital, Mutwini, even small hospitals like Babadogo, Kahawa West, all of them have dental services now, which is a situation that was not, I mean, we didn't have these services before, and therefore there's no reason why people should go to quacks and get messed up, like the story that you guys ran the other day about the gentleman in Kawangware who died in the hands of a quack when they were trying to have an extraction, which was really a sad situation.
Right.
Yes.
I love that this is just, you know, forming the base for the conversation that we're about to have, which is, of course, dental health in pregnancy and early childhood, just how it ties to the state of, you know, our health facilities as far as the accessibility to dental health care is concerned. But we see students, you know, going into school, med school, each and every time, right? But now, is it a problem of unemployment, or what is the problem exactly? If at all you say there are counties that only, you know, have 2 dentists in the entire county, yet we see students every now and then in med school, wanaenda wanasomea dentistry, then really what's the problem there?
Yeah, that's true. In as much as the numbers are low in terms of the training, we've not yet reached the WHO.
The numbers are low in terms of training?
Yes.
So unemployment is not an issue?
It is, because we still have dentists who are unemployed, all right? And they get into, I mean, they plug into the private healthcare system, whereas in the public healthcare system, we are still suffering. So I think it is a question of priorities, that, you know, it's an appeal to the county governments that they should prioritize, you know, having these professionals in their stations, so that they're able to give these services to Mwananchi. So there are dentists available to be employed into the public healthcare system, but, you know, it is an appeal that this needs to be done.
Right. So, you know, I identify 2 problems there. Like, a lot of students are not really getting into study dentistry. And also there's a problem with employment as well. There's unemployment, but also there's very few enrollment when you're talking about dentistry, right? Let's look at this from the county, you know, government perspective. Why do county governments underlook, you know, this particular sector, the dentistry sector? When we talk about health, we talk about public health in general, right? But I'm looking at it from, you know, dental facilities at the county level to make it accessible for each and every person. As we narrow down to pregnant women, who, of course, there's a lot of questions around, this area, if whether they should be going to, to the hospital when they're pregnant or not. Then why do county governments underlook this sector?
So, like you said, two issues. Number one, the issue about training. We only have 2 schools in the country that offer dental surgery.
Only 2?
Only 2. So we have University of Nairobi and Moi University.
Countrywide.
Countrywide. So that goes to show there is a gap in terms of training, and their capacity is limited in terms of the number of dentists that they can train. Of course, we have others that have trained outside the country who also come in and join the workforce. Now, in terms of absorption into the public healthcare system, I think for the longest time, dentistry has been treated as a luxury service, all right? Where people think that these services are a luxury instead of seeing them as essential, all right? And that shows that, in terms of priority, they've not been prioritized over the years.
Yeah.
The second thing is a knowledge gap, because when people think about dentistry, they just think about extracting a tooth.
Yeah.
They don't know that, for example, when you talk about oral health, we are talking about not just the teeth, but the tissues in the mouth. They don't know that actually the mouth is the mirror of the body. That we cannot talk about, for example, nutrition without talking about good oral health, because nutrition starts from the mouth. If you have someone who's sick and you tell them to have proper nutrition, eat well and do all those things, if they have poor oral hygiene, if they have poor oral health and they have a toothache, how are they going to eat, So we tend to take the mouth away from the body. And that is the real issue. We don't see the mouth as part of the body, and in fact the integral part of the body, because that is where digestion starts, that is where we take our food, that's where we enjoy our food, right? And from what we take through the mouth, then it gives us the good general health of the body. So there has been that neglect over the years, partly because of that misconception about the mouth, and I'm glad that with this kind of educative forums and the conversations that we are having, then more emphasis is being placed on oral health, because even diseases, systemic diseases, control of systemic diseases like diabetes and all other conditions, they all start from the mouth. We can even make diagnosis of some conditions that a patient doesn't even know, just from looking at the mouth. Manifestation of most diseases is usually in the mouth. So it's not just about the teeth, but the oral health of the person.
Oh, wow. Yes. Very, very interesting. And of course, keep interacting with us on our socials. TV47 Kenya on Facebook and on YouTube, and on X at TV47 Digital. You can tag me as well at Annie_Did, and we'll be sure to sample your feedback in the course of this broadcast. We are looking at dental health in pregnancy and early childhood. When we were starting, Dr. gave them a hook. That did they know that there is a direct link between their oral health and their children? Is that true? Because when I was preparing for this particular discussion, I came across that statement and it had me hooked. Is that true?
Yes, it is true. You are very right. There is a direct link between, the oral health of the mother and the baby. I think when you're talking about a pregnant woman and the oral health of a pregnant woman, we are not just talking about the woman. We are also talking about what they're carrying, that is the unborn child. And whatever they do directly affects the health of their child. I'll just give examples just for the sake of the conversation.
Yes.
First thing is teeth formation starts in the first trimester. So first trimester, actually very early, in the first weeks of the first trimester. First trimester is the first 3 months. So at this stage, this is where we have what we call organogenesis. This is where the organs are forming, all right? And these things that are forming, teeth are part of what is forming. The nutrition of the baby is usually through the mother, from the mother. That is through the umbilical cord and gets to to the baby. Now, 2 examples. Number 1, I'll say about medication. There are medication that you can take while you're pregnant that will directly affect the teeth of the baby. Some examples of this medication is like tetracycline, which is an antibiotic, all right? And we know as Kenyans, we have this tendency of just over-the-counter medication, self-medication.
Right.
So if you take such antibiotics, it will directly affect the teeth. You actually get, like, for example, with tetracycline, you get tetracycline staining on the teeth, all right?
That's like a tablet.
Yes.
You know, we have we hear Tret and Tret, that application for the face for acne and all.
Yes, yes.
So we're talking about Tret.
This is something that you're ingesting, yes. Whatever you are taking, it's actually an antibiotic.
Okay.
So this will directly affect the teeth. That's just one medication, all right? There are many others. Another thing which is very common, and I'd really want us to insist on this, is, you know, in Nairobi nowadays, I'm sure you've heard about dental fluorosis.
Yes.
Dental fluorosis is a condition. It's actually a permanent condition that affects the outer layer of the tooth. A tooth has 3 layers.
Yeah.
There's the outer layer, which is called the enamel. This is what we see. Then we have, beneath it, we have the dentin. And then on the inner side of the tooth, we have the engine of the tooth, which is the nerves, where the nerves are. So dental fluorosis affects the outer layer of the tooth, which is supposed to be very strong, so that, you know, when you're eating and doing all those things, then, you know, you don't feel any pain. Now, if a pregnant woman takes water that has high fluoride, and this is something that we are seeing especially from borehole water.
Yeah.
And you'd agree with me that nowadays in Nairobi, almost every apartment has a borehole.
Yeah.
And the breaking news is that our aquifers in the Nairobi and its outskirts have very high fluoride. Aquifers are the, you know, the underground water that we dig a borehole and get to it. So this water usually has very high fluoride. And when someone consumes this water when they are pregnant, it will affect their child's teeth. Because like we said, these teeth are forming when they are still in the tummy.
Just 3 months in.
Yeah, just even less than 3 months in, they're already forming. So if you consume this water that has high fluoride, you'll find that the teeth of the baby, when they come out, they are mottling, they are weak. Because what fluorosis does, it weakens the outer layer of the tooth, so that now it becomes very weak and mottling, and these teeth usually you find they are also discolored. So it is something that is of concern to us. It is actually an emerging dental public health concern because of the water that we are consuming in Nairobi, and it's actually leading to most children. Actually, from research which was done a while back, it shows like 44% of school-going children have varying levels of dental fluorosis. And this is a condition that we never used to see it in Nairobi.
Yeah.
We used to see it in Nakuru, Baringo, and all those other places in the Rift. But right now, because of people supplementing the water supply from boreholes, then we are having a lot of children getting this condition because it affects you from 0, that's the time that you're in your mother's womb, all the way to around 8-9 years when the teeth formation stops.
Oof.
So again, you see that's a condition that is affecting the baby's teeth through the mother.
Oh, wow.
Yes.
Kama, if you're not panicking at home, then I don't know what will make you panic, because I'm already panicking just at the thought of, you know, what I'm consuming will in turn, you know, affect my child.
Yes.
Because I'm looking at it, you know, we see kids all around, especially those from Nakuru, no offense to people of Nakuru, but they have been stereotyped that the people who, you know, usually have dental fluorosis a lot, some, you know, browning of the teeth and all. So most of them, it comes about because of the parents, what the parents used to consume? So,
yeah, but there's a rider because, like we said, this condition affects the teeth during formation.
Yeah.
So when the mother is pregnant and the child is unborn, what is forming mostly is milk teeth, all right? So if the baby is born and continues consuming this water, all right, then also the permanent teeth will get affected.
Yeah.
All right. And like you said, it is now not an Nakuru problem. Yeah? It is actually a problem that is endemic in Nairobi. Places like Utawala, that one almost, I mean, I'll have to check whether there's any research done, but from just the prevalence, it is very, very prevalent in that place. Places like Rongai. And it is not just those places we are talking about, even some places that you never even have thought about, the affluent neighborhoods. There's a colleague of mine called Dr. Wangeshi. She just called herself Mama Maji. She's very big on dental fluorosis, and probably people can check her out on her social media. She has done a lot of mapping in Nairobi. A place like Runda has very, very high fluoride, even where we are at. You know, just sampling the water from the boreholes, it's very, very high. The recommended level of fluoride is 0.5 milligrams per liter. In some of the places from Mama Maji's statistics, a place like Runda, there has been even levels of up to 35 milligrams per liter. Remember, the recommended is 0.5. Places like Riverside, very high concentration. Places like Karen, all right, has very high fluoride concentration. And unfortunately, this is where most of the water bowsers get the water for distribution to our households. You know? So it is really a big concern. And really, the good thing is it's a preventable condition. There are ways that you can be able to prevent this by installing some defluoridation machines in your household. So that now the water that you are taking, you have control. Because even some of this water that we buy from the vendors in the estates, all that they do is they clean it and make it safe, free from organic contaminants. That's the bacteria and all those things. But then it doesn't touch the inorganic component like fluoride and other heavy metals. So it is important that people take charge of the water that they are drinking at home to ensure that it is safe. That is at the household level, and also for the developers. When they are developing and telling us, oh, come to our apartment because we have constant water supply from the borehole. How safe is that water? Has it been tested? If it has high fluoride and other contaminants, please ensure that you have water purifiers to prevent this water from getting, these dangerous chemicals from getting to the households. And we are not just talking about fluoride, because of course I'm a dentist, fluoride is of concern, but also other heavy metals like lead. These are associated with cancers. Could it be the reason why there is a rise in prevalence of cancers even to people who do not have or do not engage in those risk factors? So it's a big conversation that needs to be had. Of course, we cannot exhaust this in this interview, but I'd probably tell people to follow Dr. Wangeshi Mama Maji. She does a good job in that aspect.
But you know, Doc, we hear that fluoride is good for the teeth.
Yes.
Especially these toothpastes that have fluoride in them. But if you're saying that the recommended fluoride level is just 0.5%, then how do we strike that balance between good amount of fluoride for our teeth and now bad? Looking past that 0.5% that is recommended.
Yes. That's a fantastic question. Now, there are two things that we have to separate. There is ingestion, meaning that you are taking, and there is topical. Topical means it's being just applied. Now, I normally like saying that fluoride is both an angel, but also it can be a devil. So it's an angel when you apply it on the teeth, application, like venye tuna applyingi mafuta kwa skin, right? When applied on the teeth, it is an angel. Why? Because it helps the teeth to remineralize, all right? And it also helps us to prevent cavities. And that is why we recommend use of fluoridated toothpastes. In fact, toothpaste has very high fluoride because it's good to prevent cavities and all those things.
All toothpaste?
Yes, most toothpastes. So long as it's fluoridated toothpaste, you'll find that it even has over 1,000 milligrams per liter of fluoride. So which is good because it's being applied on the teeth and then you spit it out. Fluoride becomes a devil when you swallow it. And that's why we are talking mostly about water, because you drink water. So when it gets into the system and gets into circulation, that's when it becomes a devil. Because now it will affect teeth of children who are, at that age when the teeth are forming. It, however, does not affect the teeth for you and me, for adults, because our teeth, teeth are very unique. I think it's probably 1 or 2 parts of the body that do not regenerate. So like once it forms, that's it. So if you cut your nails, they'll regrow. If you cut your hair, it grows back. If you cut your skin, it will heal and grow back. But if the teeth, once they form, they do not change. They're supposed to be like that. So when the teeth are forming and they get exposed to high fluoride, that's now when they get affected. And that's why we're saying for kids. For adults, if you get exposed, it will not affect your teeth, but it will affect other systems. For example, it can affect your bones.
Oh, wow.
The same way, because the composition of the bones and the teeth is more or less the same. All right? So for adults, it will affect bones. It gets deposited in we call it the musculoskeletal system. That is the muscles and the bones. And probably that's why we are having a lot of people who are young having arthritis-like symptoms. Magoti nauma, sijui nini. It's probably because of that, because it affects, the same way it affects your teeth and makes them mortal, like it makes them very weak. It will also be deposited in your ligaments and your bones, and it will make them weak. The only difference is bones, we can't see them, so you are not able to know. But actually now you feel it. You feel that you are having pain in your joints and all those other places because of this fluoride. So, good question. Fluoride is recommended to apply topically, but when you swallow it, then it becomes a problem. And that's why, even for kids, I always like insisting on this. Kids sometimes eat toothpaste, all right? Toothpaste is a drug. The same way you cannot tell your kid, enda ujiekee paracetamol ukunywe. Ni wewe unamwekeanga. Juende unajua the kiwango, the right amount that you're supposed to put. The same thing with toothpaste. We normally say it should be a pea size for kids. Unaenda, unamwekea kadogo, kwa toothpaste kadogo sana, then anabrush nayo. Hata akimeza, it's not too much in the system. But what do we do as parents? Shika uende ubrush. Anaenda anakaa chini ya sink, kwanza anakula hiyo kitu.
Ananyonya.
Then you wonder, your water was okay, everything was okay, but your kid has dental fluorosis. The teeth are brown. Why? It's because they ingested the fluoride from the toothpaste, and that is now usually very conk. It's like taking a concoction of fluoride.
Doc, there's something I'd love for you to clarify on. Once, dental fluorosis now, imekupata, you're with it now, it's within you. Can it be cleared, say for an adult, right? Because I'm thinking if it's a kid, then there's chances of regeneration. You said, ukishakuwa mkubwa, regeneration is almost so hard because your teeth have already developed. Then for kids, or even adults, looking at it from a broader perspective, for both kids and adults, is it possible to fix that problem, dental fluorosis?
So unfortunately, it is an irreversible process. So once it affects the tooth, that's it.
For both kids and adults?
Yes, for both kids and adults, because like we said, it affects the tooth during formation. So you can imagine you are forming the tooth, so the fluoride gets incorporated into the tooth.
I'm in denial.
So now, but meaning it is an irreversible, meaning that you cannot reverse the process once it has happened. However, that's why we have dentists, all right? So as dentists, we can be able to mask out the problem, because the problem of fluorosis is two-pronged, actually three-pronged. Number one, the issue of function. Because when those teeth are zimekatika, you are not able to function properly, you are not able to eat. There is a lot of sensitivity, because we say the dentine, which is the sensitive part of the tooth, is exposed because it's not covered by the enamel. So there is a lot of sensitivity. So function is affected. Number two, the aesthetics. And we were having a conversation with you off air about dental health and mental health.
And I was coming to that. Because, we only hear of, mental health. You have to take care of your mental health, or mental health, mental illnesses are on the rise and all. but rarely do we sit down and talk about dental health. And na ziko na rhyme.
Ziko linked, especially now with the issue of dental fluorosis.
Yeah.
I'm sure probably you've seen people with brown teeth.
Yes.
And those teeth that are really affected by dental fluorosis. You know, a smile is something that gives you personality.
Yes.
It is what you share. That's the first thing that people see when they look at you. Now you can imagine you have these teeth that are really discolored. They are mottled. They don't look like the way the teeth are supposed to look like. What does that do, especially to a teenager? It really messes up with their self-esteem.
Yeah.
All right? And, you know, the issues of self-esteem come with other interrelated expressions, including depression. You know, they can't smile. They have to change their personality. And in kids, especially in school, they get bullied. They, you know, get called all sorts of names. And this messes up with their self-esteem.
Yeah.
And definitely, by extension, their mental health. So dental fluorosis does not just mess up the functionality of the teeth, but it also messes up the aesthetic look of the patient, and this by extension now leads to mental health issues, which include the issue of, like you said, self-esteem. Sometimes people can get depressed. I've had patients who've come and they cannot even get a job, highly qualified, but just when they smile, they get segregated, and they cannot be able to get a job just because of their teeth. Someone is very well qualified. What does that do to them? It really affects their
That happens?
Yeah, it does happen. We've again, I'd still insist people to check out Dr. Wangeshi Mamamaji. She has even interviewed people who've missed huge opportunities just because of their teeth. Some ladies who've not gotten married because of, you know, their smile and all that. What does that do to them? So there's a lot of trauma that comes with the dental fluorosis, and you know, now in terms of management, there are ways of managing, especially for kids. You have to mask out the discoloration. So we use a special material that we use to mask out. So remember, you're not healing, you're just hiding it.
Yeah.
You are hiding it inside so that it's not visible, number one. The teeth look like they have the normal color, and also you restore the function so that the teeth don't get sensitive. Now, for adults, the most sustainable way of restoring these teeth is using crowns. Yeah, crowns and veneers. You've heard about this.
Right.
Crowns and veneers. So if you get a proper dentist, they're able to restore your smile using either those fillings or veneers or crowns. However, they are not cheap. They are not cheap at all. So the issue of affordability and access to this service it's not accessible to everyone.
Yeah.
And that is why I'm really insisting if we can be able to prevent it from happening. Because I'll give you an example.
Yeah.
One of the machines that you can use in your household costs around 40,000. All right?
Yeah.
A crown for one tooth is 40,000.
Oh, wow.
All right? One tooth. You can imagine you have probably 4 children.
And this is why a health-seeking behavior is bad.
Yes, and that's why we are trying to make it work. Does it might work in the public health system? You know?
Tell us, Dr.
Yes.
Does, you know, the oral health of parents now affect fertility in the long run? Because I saw somewhere that for both parents, even for the male parent, if, you know, there's issues with your oral health, then it will in the long run affect your fertility, your sperm count and all. Just walk us through that as well.
Yeah, so, you know, when you talk about oral health, it is, you know, like I said, most people have been ignoring it and thinking it's just asinimeno too, you know. So there is a lot of linkage of oral health with many other things, all right? Now that we're talking about pregnant women, there are studies that have shown that, for example, poor oral health is linked to, you know, premature births, right? Where the baby is born before time, just because of poor oral health, especially something to do with periodontal disease. That is a gum disease, all right? there is research that is there and can be verified that it is also linked to low birth weight of the baby when they are born, right? So you find that the baby is born, but they are not up to scale in terms of weight, just because of poor oral hygiene. Yeah. So there is all that kind of linkage. There's even, now that we are talking about fluoride, there is research by one of our colleagues that shows that if a mother is exposed to, or children are exposed all the way from the time they were in their mother's womb to when they are young, if they're exposed to high fluoride, it's been linked to low IQ.
Oh, wow.
All right? So there is a lot of things that affect the system, that is the whole body, just from the mouth. Things like even diabetes. You know, a patient could be having diabetes and they are not able to control it, even with medication when they go to their doctors. And part of this poor control could be, has been shown by research that poor oral hygiene, like for example, when you have gum disease, it will also adversely affect the control of diabetes, where you find you're taking medication, but still you are not getting control of the disease. So if you have diabetes, which is a very common condition, especially among our people, it is important that you also, part of the management routine, and this happens in the developed world, part of the management routine is going to the dentist. When you are even planning conception, conceiving, it is important that part of the process should be visiting the dentist, all right? Because, and I'm sure we are going to delve into it, there are many things that happen during pregnancy that adversely affect oral health. You've heard these people saying, oh, when I was pregnant, I lost this tooth, that and that. So there are many issues that need to be put into, perspective, including even before conception and all those things.
I'm interested in that point, before conception. And I asked this, and you're dodging it, because I saw this question of fertility, that it does affect sperm count. Because I'm trying to look at it that if the woman who is trying, of course, to conceive is now going to the dentist just to seek, some opinion as to whether their oral health is in check. Then do they go alone or do they go with this partner? And, does it also affect the partner's ability to, produce enough sperm?
The reason why I'm dodging it is because I don't want to be taken out of context.
Clarify that for us.
It is, the issue of fertility is really, and our obs-gyn people can be able to tell us more about this. It is multifactorial. And there are many factors, including oral health factors, that can lead to low fertility. All right? However, you don't want to stress so much on that, because then people might think, oh, it's because this one has bad teeth and all those things. But yes, there is
it's a contributing factor.
Yes, among many other factors. So what we normally do is we normally talk about a diagnosis of exclusion. So where you tick the boxes, you visit your dentist, you are okay. Then, you go to your fertility specialist and tick all those boxes. Then to make sure that everything is okay. But yes, like you said, there is a connection. Of course, not very strong connection, but yes, there is some research that has been done on that issue. But most importantly, for me, is now when the woman is pregnant, because that's where a lot of myths come in. When they are expectant, you've heard people saying, oh, you cannot go to the dentist when you are pregnant, which is actually a myth. Because when a woman is pregnant, there are many things that happen to their body. The first thing is the hormonal imbalance. When they conceive, there are two main hormones, the estrogen and progesterone. There's a surge in these hormones, and also there are some behavioral things that change with the body. So when it comes to the hormones, this surge in hormones messes up the bacteria in the mouth, because we all know that we have bacteria in the mouth. a lot of bacteria, but we have a symbiotic relationship with this bacteria. So long as the pH in the mouth is maintained normal, neutral, this bacteria benefit from us, and we also benefit from the bacteria. So it's an equilibrium. But with these surges in the hormones, there is a mess up of the pH and the composition of the bacteria in the mouth, so that the good bacteria turn out to now start becoming harmful bacteria.
Yeah.
Also, there is, because of this, when the ecosystem in the mouth is changed, then it means the bacteria that cause cavities, the bacteria that cause gum disease, then they become more, pronounced, and you are more susceptible to getting this condition. Actually, there is a condition called pregnancy gingivitis, right? Where pregnant women, they have bleeding gums, they have, the gums are swollen. Sometimes they even get tumors in the gum, all right?
Caused by the pregnancy?
Yes, caused by the pregnancy. It's actually loosely called a pregnancy tumor.
Okay.
It's called pyogenic granuloma, where you find there's a huge swelling on the gum, which most people think it's cancerous. Good news, it's usually not cancerous. It's just because of the hormonal imbalance. So this hormonal imbalance messes up with the ecosystem in the mouth and turns the good bacteria to be bad bacteria, and it can cause cavities. And you are more susceptible to gum disease, more susceptible to those tumors, you are more susceptible to getting cavities when you are pregnant. And that is why we get people saying, oh, when I was pregnant, I lost this tooth.
Yeah.
Also remember, there is a changes in the body. Some pregnant women usually have a lot of vomiting.
Right.
All right? When you are vomiting, what comes out? It is coming from the stomach.
Yeah.
The stomach has usually a lot of acid. So when this acid comes into the mouth, it burns the outer protective layer of the tooth.
Yeah.
So basically the protective layer of the tooth is burnt out.
That is
what
the enamel.
The enamel, what we call erosion.
Yeah.
So it is eroded by the vomiters that is coming out. So if the protective layer is eroded out, it means that that tooth is exposed, that it can easily develop a cavity. And that is why we are saying during pregnancy, you are more susceptible to getting those cavities, those gum disease. Lastly, and we've talked about the hormonal imbalance, we've talked about the changes, the vomiting and all that, but also the feeding habits. When women, sometimes some women, when they are pregnant, their feeding habits change.
Snacking and all.
Snacking, people cannot sleep without a chocolate in their mouth. Others eat stones and all those things, sugary diet and all that.
Satisfying cravings.
Yeah, those satisfying cravings that if they are not met, then they become moody.
Yes.
Yeah, so with all those changes happening, they become more susceptible. And that's why we say it is important that before conception they go to the dentist, so that those small issues are sorted out. But most importantly, a properly qualified dentist or a community oral health officer should be able to give you this information that we are sharing. They tell you, for example, if you vomit, please make sure that you don't brush immediately, because it's like you're scrubbing your mouth with an acid. So it will damage your teeth more. All right? They'll tell you how to brush. They'll tell you how to take care of your teeth. And if there are any issues, because sometimes you can have some latent disease, like a cavity which is not yet paining, but if exposed to those acids, it will become deeper and start paining, then that is addressed before. All right? And then during the pregnancy, we normally say the best time to visit your dentist is during the second trimester.
Right.
So that time, procedures can be done. You can have cleaning if it needs to be done. You can have fillings, you can have root canals and all those things. But again, you have to make sure that whoever is attending to you is a qualified person, because we normally say, or I like saying that as dentists, you are not treating a tooth. You are treating a patient first who has a tooth problem. Those are two different things. So there are certain conditions that have to be looked at before that treatment is instituted. Yes.
And I love that, you've just wrapped it up so well. Like, you are just alluding to every question that I wanted to ask, especially that point of what happens in the mouth of a pregnant woman, really, and the hormonal changes and all. But I want you to give us your parting shot, even as we come to the end of this discussion, Daktari. What are the tips, that pregnant women should, be putting into place? I know you've talked about we should be visiting the dentist before even conception. But now, say, even the child is here, right? Then what steps should we be taking to ensure that, this child's teeth grows to be healthy and strong and all?
Yeah. Thank you very much. So I think mostly we've touched about the pregnant woman. We've said that there's those things that need to be done before conception. Just visiting your dentist and making sure that, because there'll be so many changes when you're pregnant. So you want to just make sure that you are okay, all right? And those things that need to be addressed are addressed. Second is that we busted the myth that you cannot visit a dentist when you're pregnant.
Right.
You can, but just ensure that you visit a properly qualified person and a reputable facility, because like we said, there are so many quacks on the run. In fact, by estimation, the probability of you getting a dentist, let's say in Nairobi, is like 30%. Like just walking to any place and just getting a properly qualified dentist is probably very low, less than 50%. So you have to do your due diligence. And when not sure, please just visit one of our facilities, one of our public facilities. I don't know why there is a lot of, Kenyans love private clinics, but
they're cheap.
They are not cheap.
That's what we're told.
No, private facilities are very expensive.
Really?
And those ones who are cheap, most likely you're not being attended to.
I know you're winding up, but give me an estimate, for example.
Yes.
Cleaning of the teeth in a public hospital.
Yes. If you go to a public hospital in Nairobi County, let's say if you go to Mama Lucy, Kibaki Hospital, cleaning of all your teeth is between 500 and 1,000.
All right.
If you go to Dr. Muriuki in a private clinic, you'll pay in excess of not anything less than 8,000 going up. If you go to a quack, probably it will be, slightly, they just mark up with our facilities. They just mark up kidogo. But you see now, government is not in the business of making profit. It is just in the business of offering sustainable services. So they're just meeting the cost of doing that service, and that's why it's cheap. It does not mean that it is inferior. Of course, there is a waiting line because there are many people, but if you cannot afford a proper, you just go to a public hospital. Number two is that during pregnancy, there are many things that are happening in your mouth, and you need to make sure that you are aware. Like, for example, if you vomit a lot, ensure that you don't brush immediately. When you vomit, you just rinse your mouth with even salty water, just to neutralize the acid before brushing.
Just hold on to that thought, Daktari, because I'm going to talk to Mary to bring you in again. Mary is our producer, right?
Yes.
To bring you in again so that we can pick up from this point, because there's so much to learn.
Yes.
And I know maybe pregnant moms and people who are thinking of maybe, having a baby would consider this particular conversation here. So thank you so much, Dr. PJ, for making time for us. Again, I don't want to pronounce your second name out of respect. I do not want to butcher it.
Yes.
Dr. PJ is the Chief Dentist, Nairobi County, speaking to us about dental health in pregnancy and early childhood. But right now, I want us to cross over to Emurua Dikir. We do understand that residents of Emurua Dikir continue to cast their ballots across various polling stations in the constituency, and my colleague SIGNET Chazima is on standby to tell us everything that we need to know as regards to that process of voting in Emurua Dikir. Remember, voting began at 6 a.m. and it will go all the way till 5 p.m. and we'll be bringing you these details throughout the day today. Sydney?
As you rightly put it, I'm here for the details, and the details are so far that we are at SIGNET Primary School, where DCP's candidate, who is Vincent Kibet, is expected to cast his vote here at this primary school. And what we've observed so far here is that there are a bit of a low turnout here. We've just seen an 87-year-old woman casting her vote at one of these polling streams here. And what I can also report is that we've seen a bit of youth turning out to vote at this particular station, which is something that we hadn't seen earlier as the day kicked off. And what I can give you, Odida, as well, is a bit of a profile about David, or Vincent, I should say, who will be voting to this classroom, or the stream here, is that he is a former chief. And he's also the former MCA of Mogondo Ward, right here in Emuru Dikir. And he came into the limelight after the endorsement of Rigathi Gachagua through a direct ticket to vie for this parliamentary seat on a DCP party ticket. He's also come to the limelight after several huge campaigns in this area, which is largely touted as a UDA stronghold. And we've seen rallies that he has been holding across this area, colored with the DCP party's emblems and colors, flooding all over social media. And this is a race that has garnered national recognition because of the race that is pitting Rigathi Gachagua and William Ruto through their parties, UDA and DCP respectively. So it is something we are watching closely. And later on, we shall be heading to the Constituency Tallying Center at Emuru Dikir, where we shall be speaking to the UDA candidate, David Ketere, who shall be coming there. He is not voting from there, but he shall be coming there because of situations of difficulty in accessing his polling station. So we shall be giving that update in our subsequent bulletin in Swahili, I believe is coming ahead. So Odida, so far, so good. The queues here are a bit minimal, but we shall be observing throughout the day and see what's happening really. So Odida, we are yet to see the sun. The weather is overcast, but our main interest is knowing which son of this soil will emerge victorious during the day or throughout this by-election. Back to you in studio.
All right, thank you so much, Sydney Chazima, for that update. And of course, we'll be linking up with you later on, of course, in our subsequent bulletins, so that we can as well just have a look at which sign of the Emuru Dikir soil will be able to clinch that seat. Right about now, I want us to cross over to Milimani Law Courts, where the impeachment case of former Deputy President Rigathi Gachagua is currently ongoing. Remember, yesterday, Dr. Dan Gikonyo took his witness stand, but let's cross over there and take a look at what's happening today.
What the court is saying in terms of demands on the court's time. But we are willing to accept very, very short time to reply, as is the normal practice, in order to complete hearing.